Okay. It's my pleasure to introduce Georgia Davenport. Your title doesn't quite live up to what your responsibilities are. So what is it?
I know it. Interim campaign director.
Interim campaign director.
Perpetually interim.
But basically, from what I see, you're involved in just about everything, and I don't know how you have another life at this point in time, but they've been doing some amazing work across the state and bringing all kinds of new people, younger people, diverse people into the struggle for single payer.
I'm just going to give a brief campaign update, and then I'll ask for questions, and then I also want to turn it over to Laura because she's got some announcements about the campaign and what we're doing in the future to ensure that we're going to get the 300,000 plus signatures we need to get on the ballot. Well, actually, let me back up. We actually only need 260,000 valid signatures. As an initiative campaign, you always want to overshoot that number just in case you have some invalid signatures that get thrown out. So I am on the executive board of the 33rd Legislative District Democrats organization, and my chair, one time she said, I've never met a microphone that I don't love. And I have the exact opposite feeling about microphones. Like, I want to be like, okay, so I said my piece, I said my name, here you go. but okay, like David said, my name's Georgia Davenport. I am the interim campaign director, and I have been for over a year now. We are trying desperately to hire people, but that requires some fundraising, and we're doing actually really well recently. So we are going to put out some job descriptions next week to hire some staff, which we need in every congressional district. That's part of our field plan, but I'll get to that in a little bit. Exciting news. It's been almost overwhelming, the response we have gotten from grassroots organizations all over the state and volunteers all over the state. We printed 7,500 petitions, and there's 20 signatures per petition, and we ran out in a month. We had to do a reprint. So now we've printed another 2,500 petitions, and we're already almost out of that print. So that's 180,000 potential signatures in circulation already. We just need to get those petitions back. And they are coming back. The first couple weeks, we were biting our nails a little bit, but now our post office box is full almost every day. We just got a whole bunch turned in tonight. Thank you so much. And I got a phone call yesterday from someone in Bellingham who was very excited to report that in 1 week, their little group in Bellingham turned in 800 signatures to our initiative writing committee co-chair. So it is moving very fast, very quickly, and I'm really excited. We have some great events coming up, and we just had a few really great events with the author of our funding study, Dr. Gerald Friedman. He did a funding study. I'm not sure how many people are familiar with our initiative, but we hired him last year to start on the funding study just so that we could make sure that we have accurate numbers and good revenue streams in our initiative. His funding study concludes that we will save $9 billion annually as Washington State residents by converting to a single payer system. So that's very exciting. At the event, we ran out of t-shirts, all of the literature. I am down to 3 buttons, and those are the bumper stickers I have left. So it was really exciting. We had 4 events with Dr. Gerald Friedman around the state, Spokane, Vancouver, and 2 in Seattle. Plus he did a radio show and a Zoom call while he was here. So, and you can find all of that, like the videos from that, his slideshow on our website, which is on1600.org. We also have a whole Washington.org, but we're converting to our initiative number just for marketing purposes so everybody recognizes that. Okay, also on on1600.org you can find signature gathering events. I would really like to encourage you. This weekend we have lots of events happening in Seattle, legislative district caucuses. We have 29 volunteers going to 29 different LDs to collect signatures. We also have a team that's going to be at the March for Our Lives. I think there's 5 people, but if anybody wants to volunteer for that, just go to our website. You can RSVP and we'll get you connected with a lead who will get you petition boards, petitions, pens, everything you need, literature. Also, there's a Trevor Noah event on Friday night, and we have 3 or 4 people going to that, but we would like more signature gatherers at that event too, because we have a feeling that there's going to be a lot of progressive people who are standing in line and want nothing more than to sign for universal health care. I think that's basically my spiel. Anybody have any questions about the campaign?
What exactly is 1600, Initiative 1600? What is it promoting more specifically? I'm not familiar with it.
Sure. So it's based on the WISP bill, which you've heard about. That the author of the WISP bill was on our initiative writing committee. So it establishes the whole Washington Healthcare Trust, which does the same thing as the Washington Health Trust in the WISP bill. It covers dental, vision, all essential health benefits, no co-pays, no deductibles.
Except for $250 for drugs.
For non-generic drugs.
To try to get people.
So, but at the doctor, you're not going to pay any co-pays. But if you decide you want like name brand drugs at the pharmacy, you'll pay a copay on that. There's a cap though.
It's $250 a year.
Okay.
Yeah.
There you go. Let's see. There's so much to say about the initiative. We're coming out with a calculator, but I've tested the calculator since I was helping the coders create it. For my family, we're going to save $3,000 a year with this new system. And like I said, it covers our dental and vision, and we won't have to be paying deductibles. Every time we go to the emergency room, we have to pay 20%, which can be quite a lot if you have a 6-year-old kid who gets sick a bit. So, yeah, any other questions about the initiative?
Well, it sounds like it's similar to the WISP.
Yeah, it's based on the WISP, yeah.
Okay.
The only difference is, A, it's got funding in it. So it outlines what kind of taxes we have to use. Because in an initiative, it has to be fully funded. The legislature, especially an initiative to the people, this is an initiative to the people, once it passes, it needs to be fully encompassed. There's no changing it and adding stuff to it. So, and then the transition plan is different. At the beginning, employers and some groups don't have to be covered, but after you get to 51%, that's the transition plan is a little complicated for me to explain as a campaign director. But eventually, just like Bernie Sanders' bill actually, eventually everyone will be on the system.
So the big question for me is Gerald Friedman's study is great, but it's assuming that all those federal monies are included.
Mm-hmm.
But the initiative does not, it starts with before those monies are included. So it's got to more or less pay for itself through, you know, what the premiums or whatever before the federal money is available. Hopefully it will be available, and Pramila Jayapal in a couple of weeks is going to introduce legislation that's going to help states get waivers for those federal monies like Medicare, Medicaid, TRICARE, and federal employees benefit program and a bunch of other things, which is included in Jerry's study that makes that allows that 16 billion saving or 9 billion savings or whatever it is.
Yeah, originally it's 16 billion, but because we're expanding the system and
so what do we tell people about how is it going to be, funded from the get-go in 2019 or whatever?
So that would be a question for our initiative writing committee. I'm a campaign director. I can get back to you.
The funding? I can tell you
Okay.
what the funding is.
Okay.
So there's 4 funding mechanisms. The main one is 8.5% payroll tax. So currently my company, they pay, I figured out what, they made it very clear how much to me, how much they were paying for my medical benefits. So I figured it out, and they pay a little over 15.1% of my income for medical benefits. So that would be reduced for them to actually a little less than 8.5%. It's 8.5% less some money that they don't have to claim. So it's actually about 7%. So, and then on capital gains income, it's also that same 8.5%. So for people who get a lot of income from capital gains, that's also the same amount. That's a very small number of people. Okay, there's four. There's the payroll tax. There's the capital gains tax.
Income and
There's
premiums.
There's the premium, which depends on your income. Anybody who makes less than 200% of the federal poverty level would not pay anything at all. But for everybody above, it's kind of a graduated premium based on your income. And the maximum for that is $200. And Dr. Friedman did the funding study based on it being at the Medicare Plan B premium, which is $134 a month. So we would potentially be able to go up to $200, the maximum of $200 a month if we wanted to, without going and asking for additional taxes for that one. And then now the most unpopular portion, which everybody's upset about, is the 1% income tax. So for everybody, based on your income, your adjusted gross income, there's a 1% tax. So it's less than $1,000 a year for myself. You exempt the first $15,000 of a person's income, and that's all we can do legally, and then it would be 1%. So for myself, I'd pay it'd be less than $1,000. Okay, I pay about $120 a month for my portion of my insurance benefits. So I get to pay less, and now that money becomes taxable, or a tax write-off on my federal income tax, which I've never been able to do. So.
Well, and actually, now that I'm thinking about your question a little bit more, I think that is taken care of in the transition plan, because the transition plan waits until the 51% to pull everyone in. And so in the meantime, those of us who are opting in are paying our premiums and the taxes.
Right.
But I can also, if you want to send that question to me, I can send it on to Sarah, Aaron, and Gerald, so that they can answer it in a more technical way than I can.
I think if you closely read the initiative, which I did last night, I made some notes, you should be able to answer it, but probably, I couldn't. But anyway, I think what you said is, it looks like it breaks it down into the health security assessment, which is the tax on your payroll, or whatever you want to, assessment on your payroll, and then the personal security assessment, or personal health assessment, which is the 1% thing. But with the health security assessment, that 8.5%, it can be paid by your employer, by you, or split, or what?
No, that's a payroll tax, so it's your employer will pay.
The employer pays that.
What if, they have to, basically,
Yes, they do.
offer
But
insurance.
like Catherine said, right now, they're paying upwards of 16% for private insurance taxes, is what I like to call them.
Even if they don't offer you a health plan.
No, if they don't offer you a health plan, then they're not paying
Right.
it, so they will start paying it.
Okay,
Right.
I understand.
But they will be paying it and not,
So you won't get taxed on your payroll?
no. The income tax gets taken out of your paycheck, the 1%. But the 8.5%
You'll
is
still get the
payroll.
Medicare tax that
But-
they take on your payroll too, right?
Yes,
Until you get the waiver,
until
right?
you get the waiver, and then all of that will also,
I understand, and we definitely need to get waivers.
Yeah.
but I think that's why they did the transition plan the way they did, to make sure that the funding would be sufficient in the interim until we can get those waivers and until we get 51%, which then the system will pay for itself. And I think that Gerald did do like a $1 billion buffer. In his presentation the other evening, I was like, really, I didn't realize that. So you have a $1 billion buffer, so that's good. Do you have a question?
What does it say about long-term care at the present time?
Yeah, long-term care is covered.
Any limitations to that?
2020, I think.
Yeah,
They have to figure it
Not
out.
initially, but when we wanted to address it.
here's what the frequently asked question says. It says the coverage will include limited long-term care
Limited,
benefits.
yeah, that's what I was
hospice,
trying
and
to
end
get
of
at,
life.
how
Pardon?
limited is it? You got Alzheimer's disease, nursing home, you have 8 years of every month, 5K to 10K,
Yeah,
Right.
depending upon the nursing home, that's a big hit,
right.
yeah.
I'm probably missing some things. I've been kind of out of commission for a couple months, but I thought that we couldn't have an income tax in the state, and that's being appealed and everything else, but right now we can't have an income tax.
In the Washington State Constitution, we are allowed a 1% income tax.
Oh.
It cannot be graduated, it has to be uniform. That's what it says in the Constitution, which means that we can't have a progressive income tax. But it also does say in the last line of that section that you can exempt up to $15,000. So that's how we made it slightly progressive.
Okay, and another question is, in terms of the payroll tax, do you have limits on the size of the business?
No, there are no limits, but a business can apply for a hardship waiver. So if you have 2 employees and it's going to be a hardship, you can definitely apply for that waiver.
Is that written out what the hardship is?
I'm sure it's in the initiative.
No, I don't think it is. That's left for the board to decide, I
Oh,
believe.
yeah.
The board. What did I want to say? I'm sorry.
Was it about the income tax?
Oh, even if you, your employer weren't to cover you, a person could pay it themselves if your employer did not.
Oh, I was going to say, in the second page of this 40-page long, you know, each initiative's got to have a copy of what the initiative is about, so this thing reads like a 40-page long thing. But, you know, if you have a good degree in, or, you know, some courses in federal income tax or, you know, accounting, you might be able to understand it. But, but I just wanted to say, I very rarely have had anybody ask about how it's paid for. I've maybe suggested that it's about the same as what you're currently paying under the Affordable Care Act, and that it's slightly progressive for incomes up to $94,000, and you know, some break point, and you know, so it is actually a progressive funding source, but kind of in a conniving type way. But I've never had anybody really go into how it's funded, because Obamacare kind of fleshes that out to a certain extent. And also, you never hear anybody talk about, you know, tort questions, because Obamacare hasn't had, you know, Obamacare has happened, and there's not a big tort question, you know, about whether doctors are going to get sued or whatever. So some of the old rubrics that you got from talking to people about health care are hardly even, you know, mentioned, because Affordable Care Act has kind of cleared the way for a lot of that kind of stuff in an interesting way.
Yeah, so about the income tax and about people asking that question, we did do polling on income tax versus sales tax. And it was like 2/3 of the people we polled preferred an income tax, just because they know that the sales tax is so regressive in this state. And so, and we did try to make it as progressive, sneakily.
Did you say the 15,000 is exempt or 1,500?
Yeah, exempt, 15,000. The first 15,000 of your,
$1.5 million is when people start getting, doesn't that mean that it doesn't?
no, so if I make, let's say, $75,000 a year, my income tax is gonna only be on the 60,000. So 15,000 is exempt.
You said that was in the Constitution, and this
Yeah.
is a stupid question. So 15,000, how long's that been? Has that been increased for inflation?
So actually, there are several amendments you can read back. The first
okay.
time they wrote it, it was $300 was
Oh,
exempt.
okay.
And then it was 600, and then most recently, I think it was in 2016, they increased it to 15,000. but don't quote me on that. I am writing and helping write a fact about that.
Oh, okay.
That we're gonna put on our website that references the exact section
Okay.
in the Constitution with a link. So that, because that question is coming up a lot. I don't know, because I was under that assumption
right.
for a long time that an income tax was unconstitutional, and that's why we weren't looking at it to begin with. We were always thinking, oh, we'll do a sales tax. And then an amazing initiative writing chair was like, no, where did you get that idea? It's right here, we can do 1%. So, I mean, you just gotta read that. It's just one section, and it clearly says that you can do it, it just has to be uniform. Oh, and I also wanted to point out real quickly that if somebody does have those questions, it's right in the description. It says, this measure would require establishment of a comprehensive state program to pay for health care for all Washington residents by November 2019, funded by premiums and taxes on employers, individual income, and capital gains. We're very clear. We're not trying to hide anything. We don't want somebody to be like, did you? No. That's an income tax. Yes, it says it right on the front. So.
Well, I never heard of that 1% before, and I'm amazed that the legislator hasn't tacked it on already.
I'm not. I know the legislator, I'm not.
I mean, with the school thing and.
All right.
And I think, if I'm not mistaken, you can only do 1%. So they can't next year be like, well, since whole Washington passed this initiative, now income tax is okay, so now we can give you a 10% income tax. Nope, 1%.
Does the Constitution define income that 1% applies to?
It says property. It's very vague. So, yeah.
When they include income as property.
Yeah.
When's your petition deadline?
July 6th.
Oh, you still got a lot to do.
Yeah, we still have a long ways to go. I think we have about 10,000 signatures banked, but again, we have a ton of petitions out circulating. So we just need to get people to turn those things in.
You said you have 10,000 in?
Yeah.
10,000 signatures.
Mm-hmm.
Do you have an office now, or?
No, we don't have an office yet. So if anybody knows like a union building that's willing to give us cheap rent or free rent, we're looking for a low budget option for our organization. Oh gosh, it may be 400 square feet, just enough to have some desks and do some phone banking. I was a staffer for 735. I think our offices were about 400 to 600 square feet, but we had 2 little tiny rooms. So we could do the campaign stuff in one room and then have phone banking in another. So that would be really amazing if we could find something like that.
I will say that if you're a different subject, but if you're in the city of Seattle and you want to get a lot of signatures done in a hurry, Green Lake is the excellent place to do
yes,
that.
we found that out.
And it's just on a good day, if on a weekday, anytime after 4 o'clock in the afternoon, that's what I call prime time. It's great for getting signatures. Also, if the weather's decent, the weekends are going to be really phenomenal for you doing that. So I highly encourage people to think strongly about Green Lake.
And the Mariners baseball games, that's a good spot.
Oh,
Ferries.
Yes, ferries have
Yeah,
good.
ferries are big. I heard somebody say ferries. I did bring a lot of blank petitions. Is anybody wanting to take any petitions with you tonight? Okay, awesome.
I'm going to go with Juba, please.
I have a question about that. I have one that's got about 12 signatures on it or something. Do you want people to send them in even if they're not fully finished?
Yeah,
or-
I mean, it's up to you. If you feel like you can fill it out,
Well, no.
then that's, but if you think that that's about, you're capped out, then just send it back, because then we know how many we have, yeah.
You know, if you've still got a couple of months, you can
Right.
carry it to like.
David,
It'd be better to have.
you have that petition here? tonight?
Yeah, because you can get it filled right now.
No, I left it home.
Yeah.
Can I see what's on the back?
Did you sign it last time?
Yeah, we,
I had it at the last meeting.
oh yeah, thanks. Also, speaking of offices and money and budgets, I do have remit envelopes for anybody who'd like to donate tonight to help us pay for petitions, for printing them. Printing these petitions, it's very expensive. Also printing literature and getting supplies for petition boards. All of that's very expensive.
What about yard signs? Are they too expensive? Or?
No, so yard signs usually happen for get out the vote portions of the campaign, but so many people have been asking for them. We're actually in the middle of designing one right now. So, which I think is pretty amazing, the amount of people who are like, why don't you have more buttons? Give me 100 buttons right now. So it's nice to see that kind of energy. Anybody else remit envelope?
I have a question about this. Are there any points where you are familiar with highlighting it, where I could show somebody something that they would like to see?
I don't know if you should highlight. I mean, you could take one extra, but just don't get signatures on the ones you highlight. I don't know if the Secretary of State. Also, you'll see on these new ones, we have on the inside, it says do not cut. A lot of people were cutting the petitions and sending just the signatures. Don't cut the petitions. Because the Secretary of State wants to make sure that we actually did what we were supposed to do and have all the initiative language on the back.
If there are 300,000 signatures and they're submitted, there's a period of time before they're, ratified or accepted or whatever. How long is that period?
I don't know how long it takes them to verify all the signatures. It seemed like with de-escalate recently, it was only a couple weeks before they confirmed that their signatures were good to get on the ballot.
Yeah, I mean, they used to do it in batches, so, I'm not sure what they do right now.
Yeah.
I have a question though. Merle and Jim Squire went to Colorado, and I remember when they gave us a report back on it, one of the things that people at the door would say, how does this affect my Medicare? And so they'd want a direct answer. I mean, like, am I, Medicare is complicated as it is. How is this going to affect that? And also with Medicaid, where people aren't paying any co-pays right now, any deductibles, and with the 15,000 income tax and basically they're at like 30,000 not paying anything. So wouldn't they be paying more for?
No, so our limit is 200% over federal poverty level, which I think is actually 50% more than the current AppleCare covers. So anybody under 200% federal poverty level doesn't pay.
Okay, that would be good to have in the Q&A, because I think that was something that was asked pretty specifically. Was that right, Merle?
Well, I don't know. About the question about Medicare, it's number 6 on this little thing, or which is a thing that you can get online is most frequently asked questions. And it discusses that. I kind of wonder, the language in the thing, which I call a 40-page book, but the language on the thing says that Medicare, Medicaid, or these things will be reimbursed before you fold them all in from the federal.
Medicare will be the
What's that really
premium.
mean?
So basically, anything that you're paying for your Medicare, the Part A, B, and C, all of that's very confusing to me.
Yeah.
But people on Medicare pay some premiums, and I guess that's going to be reimbursed through the.
That's my understanding.
Yeah.
Is that if they sign up for Whole Washington, they would pay the premiums of whatever the Whole Washington is, and then their Medicare would be reimbursed.
Yeah, and you get
Their
vision
Medicare.
and dental,
Right.
and a whole bunch of other essential benefits that you don't get currently under.
Yeah, this is what I didn't understand about this, is, it's gonna save $9 billion in administrative costs. A huge part of administrative costs in healthcare is our billing system, but if you're interacting with Medicare, how do you change the billing system that you're cutting out all these administrative costs, you know, you have to really change the basics of the billing system. I think it's the person behind you has an answer.
I was just going to say, I think that it works exactly the same way as Med Advantage plan does. Your Medicare reimburses the company that you're insured with, and your Part B premium comes out of your Social Security and goes to Medicare. It goes to them,
So
and then they...
Essentially, everybody would be capitated
Not necessarily, because capitation is what insurance companies do to control costs. What will happen with Whole Washington is their plan will be applied, and if you go to group health, they have all their rules. And if you go and get a plan through Primera, they have a different set of rules. And so they're not the same, and none of them, except for a few Medicare basics, are stuck with the Medicare reimbursement and the Medicare rules. So if you have a plan with Primera, Med Advantage plan with them, and they don't require authorization for an MRI, but you go to group health and they do, then you still have to get your MRI for authorization for, I should say not group health, but Kaiser. I'm old.
Yeah.
Group health for 70 years, and all of a sudden. And then, and with Primera, you wouldn't have to have it. So their rules will be different, but with Whole Washington, they'll all be the same for the first time. Don't you, I don't know if you have a private practice?
No.
Well, if you had a private practice, you would have all these different insurance companies. You'd have the VA, you'd have the L&I rules, you'd have group health rules, you'd have Primera, Regents, you'd have all these different rules. And every one of them, and almost every instance, is unique and different from the others. And so you have to pay attention to that. And that's why reimbursement is such a juggernaut. And why having one plan will simplify all of
So is it a negotiated fee schedule? How are the doctors paid?
It is going to be a
it.
negotiated.
It will
fee
be
schedule.
negotiated.
Yes.
With who? Who negotiates?
With the providers.
Individually?
I don't, that I'm not sure. I think
Yeah, I mean, one of the problems with the current system is that reimbursement. You know, if you're like a Providence healthcare system, you're the 900-pound gorilla in the neighborhood, and you kind of go to the insurance companies. You can get really good rates. But if you are like a solo practitioner, they hand you a sheet and say, "You're taking it, doctor." So one of the ways to level the playing field is to require that all payers are paid equally on a fee-for-service basis. Certainly, that's how it's a fee-for-service system in Canada. You know, and a single payer, that's the way they do it. So there are no advantages to being large and having a lot of leverage in negotiating. So I don't know what the specifics of this plan are. Whether it's everybody gets the same thing, or everybody is going to negotiate their individual fee schedules. But certainly, large plans would be advantaged in a negotiating situation. Large companies.
And your question was contained, I think, maybe a little bit of a difference there. The way I look at the savings just isn't an administrative cost. It drops the savings from 24% of what the outcome unrelated. The 28 or 30 most industrialized countries all get is a bulk negotiation with these very pricey pharmaceutical companies that we're the only ones who really get charged that full price that they exact. So you have that as a savings. You have another savings is your idea that you're covering everybody in the state. Thus, you don't have people who are afraid to go get preventative care, who don't have insurance, and are also afraid to get preventative care, coming to emergency wards and becoming sicker. That you have to pay for. Your premiums rise because the hospitals will duff that off to you.
I think in Massachusetts that actually wasn't true. I mean, it's better, but more people utilize your system. For instance, more people get their hip replacements and the knee replacements. So especially in the first few years, in Massachusetts, they found that the healthcare costs went up, not down, because
it's a transition.
You have that transition of utilization.
Like more people died, I think, after Obamacare. Like they talked about how for the first time mortality has dropped in the U.S. Amongst males, I think, by males.
White non-college educated males.
Is it then?
Mortality has dropped.
So that's what healthcare does for you. Kills you.
Okay, how much more time do we have? Because I'd like Laura to be able to talk a little bit about May 6th.
Usually we go to 9 o'clock,
Oh,
and
okay.
we got plenty of
All
time.
right, we have plenty.
I have another question about signature gathering.
Okay.
I mean, I'm sorry, Rob, did
Yeah,
I see
the
the?
question that I feel comfortable answering?
Happy to help.
You're killing me.
They've got a great site though for it.
Yes,
Well,
yes.
yeah,
And I can forward any questions that I can't answer to the people that actually know legislation. And thankfully Kathleen and Sally are here. They can answer them.
my question is pertinent to the just the logistics of signature gathering. I mean, did I see? Is there a frequently asked questions or a script, or is there a so how to answer the difficult question that's posed to you? Is there?
That site is kind of long-winded, and I think the
Thank you.
advice for talking to people or introducing them to the initiative is to keep everything short.
Yes. Yeah, you don't want to get into a long drawn out conversation because we need 300,000 signatures.
Right.
So if somebody's like,
But if you're out in front of
you
Trader
can
Joe's
say-
looking for signatures or something, you might. Some people might want
Right.
to know, hey, what are the mechanics of this? I already have good insurance, so why do I care?
right, and
know what I mean?
usually
In
at
fact,
that point,
that's a lot
I'm
of
like,
people, I
here's a
think.
fact
What's the problem
sheet,
with this?
and here's our website, and
Yeah.
you can go read the initiative, and there's an executive summary of the funding study, there's an
Yeah.
executive summary of the actual initiative. So for those questions, I usually refer them to the website, unless I can answer right away.
I think also making the point that they're not voting for it today. It's
Right,
just a question of
exactly.
putting it on the
Yeah, you can say, this is just so we can get it on the ballot, so we can make a decision.
I might go on for 5 minutes with somebody, and then I just tell them, this isn't that you're in favor of this legislation. This is giving you an opportunity to other people to say something about
Pose the question.
it.
If you need other ballots, how can you get them?
You can order them on the website, or I have more
Okay,
here.
that's fine.
But there's, order a petition is right on the website.
Have you thought of, and I'm sorry, I haven't checked out the website, but are you gonna have trainings or get-togethers for signature gatherers?
So pretty much every one of those signature gathering events that are on our website, we have a lead. So if you go, like, for example, Friday night, if you go to the Trevor Noah event, there's gonna be a lead there that's been collecting signatures. They'll have petition boards, they'll have fact sheets that are similar to that. They're a little bit different, but I really like this one. He made that one. And we also have like a guide, like how to order more signatures, or more petitions, where you can actually go to collect signatures, where it's legal. All of that information you get at one of our signature gathering events when the lead just hands you everything you need to know. We'll tell you a little bit about what to say, and very good points were brought up tonight. If somebody is very argumentative, you say, thank you, have a nice day, here's the... Go to the next person who's gonna sign, because we don't have time to argue with people. Gonna sign, because we don't have time to argue with people.
Now, I worked on the campaign for the Citizens United. Wasn't that
7:35, yeah.
And they had like a video that they presented to people. I mean, I suspect, and I might be wrong about this, but people might feel nervous just getting all the information right then and there. I mean, I kind of like to do more homework, and I mean, and I realize it takes volunteers and stuff, but to have, there were a lot of groups that training, just get-togethers.
Right.
of support groups, of signature gatherers, and they showed a video which, you know, is sort of a national video, and they probably, and a lot of those videos are generic, actually, for collecting signatures. Have you thought of, when you have enough people powered, you know, doing that kind of thing?
Yes, it's been suggested, and we definitely need to get that going. But we do have, well, we have had trainings, and we, like I said, we have leads that can give you training on site.
We also have a really very active, I think, closed Facebook group for the volunteers. And so that's where a lot of, when people have questions, we can ask any question. We don't have to worry about it being stupid or going public or whatever. And really knowledgeable people about all the work that's been done and all of the language in the initiative gets answered really quickly, which has been awesome.
An email where you can ask questions, plus there's a phone number supposedly that you can.
In regard to the physician too, because I have had a couple, when I've been collecting signatures, I've had a couple of providers that have asked that same questions, and I feel, as a registered nurse who's been really involved in my career with collective bargaining over my career many times, I think it's really important that, yeah, the plan does call for individual bargaining, or hospitals and stuff can do global bargaining or for the rates. And I think it's really important for the providers to be active in saying, you know, getting those rates to where you'll be able to stay in practice. And what do you really need to stay in practice? And you can do that better, I think, as a group. So.
Well, yes and no.
Maybe not.
I mean, well, you can, I mean, I don't want to take a lot of time because it's a little bit peripheral to the conversation, but the way it works in Canada, basically the medical associations, provincial medical associations, function as a union for physicians. So everybody gets the same rate. So if it's the Manitoba Medical Association, they negotiate with the province of Manitoba, with their health board, and they basically divvy up the pie. Okay, and so everybody gets the same thing, you know. So in terms of like getting physicians together to negotiate, the only units that you can really use is the employment unit. So you've got, you know, large healthcare organizations that can negotiate with a payer, but individual practices are not able to do that. They can't collaborate. They can't share information. It's antitrust. You know, you can't even share your fees, you know, with other physicians. Really? That's right. Wow. So only if you're in this individual, you know, a collective unit such as an employment unit. So then the employer can negotiate, but then it becomes the job of the administration, and the physicians kind of lose control of that.
Well, what I understood though was that Bernie Sanders' plan, which is basically what it's based off of too. Basically, the reason why this would work well here is, when we're talking about the federal level, was the fact that the federal government was doing the negotiating for the entire country, and therefore you wouldn't have what you have in Canada, which is where each province is kind of basically fighting for the piece of the pie, if that makes any sense.
Right.
Or maybe what you have for Medicare rate setting, which is really a committee, you know, it kind of works like how utilities set rates. You have a committee with representatives of each specialty organization, and they meet. Medicare figures out what, as their consultants figure out what the real costs are, and then the committee kind of, with representatives of each specialty organization, sets rates. Because I do think, you know, that these things drive administrative overhead. I mean, you know, we may have 13 insurers in this state, but you know, I think most practices work with 4 insurers. But what drives overheads partially is just the complexity of the billing system, and you know, and if everybody's being paid a different negotiated rate, and you have to, and a Washington Healthcare Authority has to negotiate with every practice in the state, that's overhead.
Your 10,000 signatures that you have right now, what's the time frame over which you've been able to collect those? How many weeks?
It's been about 5 weeks.
5 weeks.
Yeah.
then you have to extrapolate, that you're gonna have a huge jump in rates to get to 300,000.
Well, that's how campaigns generally work, initiative campaigns, is they start out, they trickle in, and then it's an exponential growth as the campaign goes on, especially as the weather warms up. There are huge events like the Gay Pride Parade, there are farmers markets, tons of outdoor activities. People don't really want to go collect signatures in the rain. The first event we went to, it was raining.
Well, each day we're increasing our volunteer base. So when I take the petitions out, for those people that I can't get the pen into their hand fast enough, my follow-up question is immediately, would you like to volunteer for Whole Washington? Maybe can you get 20 signatures for us? So someone that's not overly, but very enthusiastic, I wouldn't necessarily let that opportunity walk away. And then I assure them that if signature gathering is not their thing, although we do need signature gatherers, that there are many ways that they can volunteer and help Whole Washington. So I just say, like, within my corner of the world down in CD6, you know, we're steadily increasing our volunteer base. So
I would say on the rainy day phenomenon is I'm trying to go to Laurelhurst for non-rainy days because they have the highest what do you call it, mortality, you know, what do you call it, longevity in the city, and then going to another location just to see how the collection of signatures go, to see whether the wealthy are more into universal health care. But anyway, that's a little experiment I have. But going door to door, I think is kind of interesting. I don't think, unless you're in pretty good shape, you're going to collect as many. But then when it rains, you can go to places like Fred Meyer. There, you know, that's where you see a lot of guys gathering signatures for paid thing, and then libraries. I mean, the people going to libraries sometimes can read, and you know they understand the issue. They're not those dolts that Hillary talks about.
Unions like Service Employees Union, Washington Nurses Association, are they taking a stand? Are they supportive?
The Washington State Nurses Association said that they will consider endorsement if we get on the ballot.
that's a for my.
Yes, I'm going to turn it over to Laura because she has a lot to say about events coming up.
I'm still, it's unclear to me. For better or worse, if I-1600 were to pass in the state of Washington, would the state of Washington have essentially expanded and improved Medicare for all as the healthcare system?
Well, so we don't like to use Medicare as the word because that's a federal program, but yes, we'll have universal health care. Everyone will be covered.
And there won't be any different groups will have different coverage and the like? That's why I'm using that term.
I think that the Indian Health Service, they can opt in. So
everybody else would be covered under the same
and I think that the VA also, they can opt in. But because of they're under different programs right now, but everyone else will automatically be enrolled after the 51%. But those groups, I 100% guarantee they will form.
Besides those groups, everybody else will be in the same group,
yes.
If you will. Okay.
Yes.
I have a question. So I'm not sure exactly how it's clear about how it's going to be paid for again. So you said up to 200%, they wouldn't have to pay anything?
Federal poverty level, yes.
And then after 200%, you said there'd be a premium?
Yes.
So people, how much, it depends on how much they make?
And it caps out at $200.
Caps out at 200.
So that's
per month?
Per month. So that's the most that you would pay, and anybody 19 and under is free. So like for my family, we're paying for my daughter for dental and vision and plus her health care, but she would be free under the system.
So it
would just be a premium for me and my husband.
So it would be mandated? What if people didn't want to? They would have to. How would they be billed for it? Would it be?
It comes out of your paycheck like Medicare or
So it's absolutely per person, not per family?
No, it's per person.
Yeah, that's cool. That's how it should be.
And so is it employer-based? What if they didn't
No.
have a job?
No.
But the employer will collect it for you?
The
For
employer will collect the payroll tax, but if you're not employed, that doesn't mean that you don't get it.
The other guy, she was going to address what Washington State Nurses Association.
Sorry. There you go. Oh, actually, I think I would like to, Catherine might like to say a word about it, because I don't want to lead with that.
Oh, well, I just initially had sent them an email and told them what we were doing and asked them for if they would endorse it, and also to try to spread it throughout the association too. And what I was told that they, well, our Washington State Nurses platform has always been for effective healthcare where everybody is covered, and so they are very supportive of it, but they don't officially take a stance until something is actually on the ballot, is what we were told. So.
Is that different from the California Nurses Association?
Oh, I'm sure it probably is.
Very much so.
Okay, hello everyone. So the name of the organization that I'm starting is called Red Berets Medicare for All, and we've applied to be an official Our Revolution group, just so that would give us some structure and people could find us. And it started from me wondering how I could use my creativity to bring together or kind of unite all of these different organizations, both at state level as well as national level, who everyone has different ideas about the best way to go about getting Medicare for all, single payer, universal health care, but we need it regardless. So it was just envisioned as a creative way to kind of reach out and unite or bring people together in a sort of visually appealing and, you know, creative way, because frankly there's a lot of crafters who want to do something, want to knit for a good cause or crochet for a good cause, and I thought universal health care, Medicare for all is certainly that. So my interest in universal health care, Medicare for all, came from my longtime service record. I'm a veteran of 4 years in the United States Air Force. So my first country where I served was South Korea, and as many of you maybe know, they have universal health care. I don't know a lot about their system, but I know they do have it. And then my husband and I served in the United Kingdom for 7.5 years, and while studying, my student colleagues, many of them would say, how do you reconcile, or how are you okay with the fact that so many people are left behind in your country? And so it always really stuck with me that as a service member, veteran, that I would go and, you know, live in a country where it wasn't a source of pride, it was a source of extreme shame. And I'm still with that, and I have a lot of mixed feelings about my service time, but one thing I am very clear about is that as a veteran, I can now speak out and use my voice, that it simply is not okay that we are one of the only major nations on earth not to guarantee healthcare as a right. And I am here to use my 25 years combined service, 4 years active duty, 21 as a spouse. My sister has dual citizenship. She lives in Canada. She and her husband both have pre-existing conditions. They will not move to the United States of America because they love their health care. So that, you know, we all know all of those things, but that's what, I guess the beret kind of does have that sort of military, but, you know, with roses and beautiful patterns, it's not quite so militant, but that's kind of the background. And the color was chosen because of National Nurses United. So back to this, you know, nursing question. It was Catherine who introduced me to Whole Washington, because I really just had a creative idea and didn't have the connections with the legislators or anybody who was actually working on this cause. I just had the creative idea. So she put me in touch with Whole Washington, and we've been really focusing locally on helping Whole Washington. So, but before I met them, it was this question of when can we march for Medicare for all, universal health care, because if we can march against something, we can certainly stand together and march for universal health care. So I really wanted to galvanize people and say, come on, let's not, this is not about just resisting something if we do not have the platform to stand on. then that's on us, right? So, and in looking at the calendar, I just wanted to choose a meaningful day that maybe would be, you know, a good thing. So I looked, and thinking of Nurses United Union, because of their strong support and stance on moving to a Medicare for all single-payer system, I chose National Nurses Day, which is May 6th. And it's taken a bit of time and the linking up with whole Washington to build a steering committee for the May 6th event. Right now, it's just us. We're kind of envisioning this as a central event in Tacoma. We have, our constituency will very greatly benefit if we're able to get whole Washington on the ballot and pass it. So, but people are welcome to organize further afield. I guess my specific ask this evening would be, we would love for you to, for your board to come together, and I know that you're already going to bring a table to the May 6th event, and thank you for that. And we would love to have someone in your membership come and speak at the May 6th event and tell us about what you do, and we just want, you know, to honor and thank our nurses for what they do, and so many of our whole Washington volunteer base are actually nurses, you know, many of them are. So it's sort of about definitely raising awareness for the need for Medicare for all, but very specifically providing a strong platform for whole Washington and helping to do that last push. It's exactly 2 months from the date. So May 6th will give us 2 more months till the signature gathering deadline. So we will definitely be aimed at pulling in more volunteers on that day. Let's see, what else? So we've sent out some speaker requests, and I guess I'll just read, because when I try to quote, I think it's open to interpretation, but oops, that's me getting too close to there, sorry. Yeah, what would be amazing is just having some wonderful, strong keynote speakers on the Medicare for All platform. So we reached out to Senator Sanders' scheduling team and have had this response back. Laura, thank you for reaching out with your thoughtful invitation for Bernie to come to Washington for this Medicare for All, Our Revolution Universal Healthcare Ballot Issue event. Your request has been received, and our scheduling team will see if there's a way for Bernie to attend your event. We will reach out with any updates, but you are welcome to reply to this email or call us in solidarity, Friends of Bernie Sanders. So Bernie has been invited, Nina Turner, president of Our Revolution National, and back to the nurses note, I need to get a couple of invitations, and if anyone has an email, I know Roseanne DeMora has retired. I have a couple of contacts that I was given for National Nurses United, but I'm thinking at this point what would be really beneficial for us is if we could get a strong surrogate from National Nurses United to come and speak at the event, because if WSNA is not planning to help us with this leap that we really need them to do, then we need to bring in another nurses union from out of state to come and speak strongly on this platform. And so I would greatly appreciate if any of you could email me if you have suggestions about who I might contact to do that. Yes?
You know Michael Leidy?
I know of him, and I know that there's an Our Revolution, I don't know what her position is, but down in Texas who has a really good relationship. I could message her.
I think an NMU policy director or something like that.
Yeah, so I should invite him, yeah.
He's a great speaker too.
Wonderful, thank you.
And Donna Smith, you know her? She's amazing. PDA.
I'll email you, and can you do that? Because this is not my, I'm finding myself, I'm the creative person, and then the organizational aspect is a little, but thankfully people that have those skill sets are coming on board to help us organize. What would be really helpful for turning out the numbers, because I feel like if we can get the event boosted, if any of you are really good on social media or know some people who would be willing to kind of share this out or send out an email to kind of ask people to RSVP to the event. If they see the numbers, that can't be a bad thing, I would really, really appreciate that. So if on Facebook is where we're primarily, that's where the event is for people to RSVP to, but we're working on like Action Network and stuff like that as well. But it is the People's March for Medicare for All, and it's in Wright Park in Tacoma. And we have the park from 9 a.m. until 6 p.m., but we'll probably start, and yes, we are going to do a march, and it's a circuitous route, so we will, but we're looking to have kind of a festival, like it's sort of a, it's a celebration and to thank nurses. And so there will be music, and it's not an angry rally. It's a place that people want to come and hang out, but while demanding real change and educating the public. So I don't know if anyone else has, the crochet pattern is, I finally met again with our web designer who is volunteering, and she's quite good, and it's redberetsmedicareforall.com.
I'd run with it. You can make little stickers, or,
yes.
It's really beautiful.
Thank you, thank you.
You can enlarge syringes like rifles and put them like Black Panthers.
Yeah. So, well, we are encouraging creativity, so we'll have a basic crochet pattern up, but if, that's another thing, we are going to knit and crochet, and it's going to be a little warm at that time, so we will probably have t-shirts, but if you know crafters, please send them to me, because we are going to be knitting and crocheting, how many we can get done, but it would be really great to have, it'll be a good fundraising, so if people are willing to knit or crochet, you can have them email me and they can donate, because we'll use it for fundraising, and like Georgia actually received one of the first felted hats with a rose. There's something, oh, I know what it was. It was, and I don't know if this is international or if more people, but I just found this article, and it was up in a certain province or university in Canada, that they've had this tradition about offering nursing graduates a red rose since 1804 or 1806. I don't know. It was kind of cool. I find these things, and because intuitively, I think I was putting the rose on, I certainly can't do it for every single beret, but a lot of them I have done, and so then it's just kind of this neat correlation, because I think it also softens and beautifies the militant, whatever. It's just, I'm encouraging people to use their creativity. It doesn't have to be a certain pattern or shade of red. We had, I don't know if any of you know, Demand Universal Health Care, just raising awareness for, I think they've really supported HR 676 a lot, and they asked if they could knit or crochet in purple because their colors are purple. And I said, yeah, this is not a rigid thing. This is about connecting up and learning about organizations that have been advocating for this for a long time. So do what you like,
Describe your great flag, your beautiful flag that you had at the theater.
Thank you. Yeah, that flag was actually, so it's probably about this tall, and from here to the other project screen. And it was just a big sheet that probably about a year ago I just had envisioned this creative project called Our Country, Our Flag. With this real, with the thought of going out and interviewing, do you feel that the American flag represents and protects you? And if not, what needs to change? I didn't really do anything with that, so it was just, so I had this hand-painted flag that kind of, I did it to look sort of weathered, and instead of the stars, there's an Earth, a planet Earth, with a bunch of different handprints of all the different shades and colors for diversity. And anyway, when the Women's March was coming up, I thought I want the Red Berets to go and have a presence because, as you know, lots of platforms are welcome at the Women's March. So I got this list in my mind that you can Google, and I don't even think it was comprehensive, but it was all of the countries that have some form of universal health care and the year that they managed to accomplish that. And it basically fit on all of the stripes. So the entire flag is filled with every country alphabetically who has universal health care and what year they got it. So I didn't bring it as a visual aid tonight. Now I kind of wish I did, but it's okay. I'm sure you'll see it. Or it's on our website, actually. There's a slider, and we've kind of put that up with May 6th, and there's a picture of Tambourine. Like, Tambourine came, and I was wondering who's gonna carry this flag with me, because I had extra signs and all this stuff, and she showed up, and she was there, and we carried it down the hill. And then we got this fantastic picture with the sunlight hitting it. So she's speaking at the May 6th March, because right after I heard her speak with Whole Washington, and she said she'd be there for Whole Washington anytime, and she showed up for me for the flag. So she's speaking. We will hear from grassroots candidates who are leading with Medicare for All, who are going to support HR 676 and 1804 and Whole Washington. So.
Speaking of that, can you tell them briefly what you and the Washington State Bernie Kratz Coalition asked of endorsed candidates?
Yes.
I think it was your idea to ask that if they've been endorsed, that they collect a certain amount of signatures.
Now, we haven't got anything, it's because it's difficult to track, but I want to get back with Washington Bernie Kratz and anyone else who is endorsing grassroots candidates and say, you know, once we hear back from our keynotes, or maybe even before that, because we have the park for such an extended period of time, so there will probably be like a peak period where but there will be a point where we can hear from all these grassroots candidates, and I would say that those people who have brought in a certain number of volunteers for Whole Washington, because I asked Georgia, I said, I have no idea how many signatures to ask for. And she said, well, you know, if it's a grassroots candidate, they should probably knock on 5,000 doors. So I think you should be able to ask for 2,000 signatures. It's tough to track unless somebody really had the time to track all of that. But I will hopefully put something in place to kind of see from like all of the different Washington Bernie Kratz endorsed candidates who has really turned in a lot of petitions, who has done events. They will receive possibly a little bit extra speaking time, but we will try to acknowledge and give just a bit of space for all of the candidates that are really going to stand for us on this issue. Okay. Thank you.
Thank you.